Assalamu alaikum. I'm Dr. Abdul Hakim Jum'a, and in this video, we'll cover the protective equipment required when dealing with a suspected case of the Ebola virus. During this year's Hajj season, and throughout the rest of the year, resources are provided to reduce healthcare workers' risk of infections. Resources to protect healthcare workers from infectious disease are called personal protective equipment, or PPE. When caring for a patient, entry into patient room or care area with a suspected or confirmed case of Ebola virus, you should perform hand hygiene and wear all of the following equipment: gloves, gown, fluid-resistant or impermeable, eye protection, such as goggles or face shield, and a face mask. If patients with Ebola virus start to hemorrhage, vomit, and have diarrhea, or large amounts of other body fluids such as blood are present in the environment, additional personal protective equipment must be worn. Extra personal protective equipment may include full-body waterproof suit that covers the whole body from the head to the ankles, double gloving, and disposable shoe covers. As with any isolation situation, when you exit the patient's room, ensure that you discard your personal protective equipment without contaminating your eyes, mucous membranes, or clothing with potentially infectious materials. The Center for Disease Control recommends you take off your personal protective equipment in this order: gloves, goggles, gown, and mask. Hand hygiene should be performed immediately after removal of personal protective equipment. Personal protective equipment exists to protect you and your healthcare team by reducing the risk for hospital-acquired infection of Ebola virus. Taking the time to properly put on and remove all required equipment will protect health workers, even in the event of caring for patients with Ebola virus.